global happenings today. We communicate, we analyze global news. Stay tuned.
Hello guys, welcome back to our channel. Have you subscribed? Please click on the red subscribe button below to subscribe to our channel. Then beside it you will see a bell notification icon. Please go ahead, click on it to get notified. Hit on the red subscribe button and also the bell notification icon to get subscribed and also get notified as soon as we update our channel on YouTube. Okay, let's go straight into the real deal. I'm afraid Nigeria is sitting on a time bomb. While we're looking at NCDC giving us accurate records and results of COVID-19 pandemic, talking about the victims and the cases, okay, of those who already are coronavirus positive. I'm afraid in Lagos, we're pushing it down to Lagos now. I'm afraid the results may not be the actual figure of what is really practicable on ground. Now, the truth of the matter is, in Nigeria today, in Nigeria for a while now, we have a very dangerous culture of not going to hospitals for checkups. The reason because as a nation, we have more of the poor people, the struggling class. In Nigeria, we really don't have three classes. We either have the poor, the very poor, or the rich. Okay, so there's really no middle class per se. But even the middle class that ought to be middle will be categorized among the poor. Why? Because there's some basic things they don't have, really. What you may call average is not really average per se. Now, let's bring it home. In Nigeria, it's very common for Nigerians, when they're down with fever, any kind of fever, the first step they do is either they'll treat malaria or typhoid, or they treat malaria and typhoid, and they go to sometimes they don't even go to a pharmaceutical company or a pharmacist. They just go to, quote and unquote, a chemist shop. Sometimes some of these shops, drugstores are not qualified, they are not certified. They are those who have learned the practice from somewhere and have learned to open shops. Some of those drugs could be substandard drugs. Those are the things that the late Dora Akuyili fought against, substandard drugs and the rest, because more often than not, they sell substandard drugs, killing more Nigerians than healing them. Now, it has become a culture in Nigeria that when anyone is down, especially those from the lower class, I'm talking about those who are financially not buoyant, each time they're down in health, they just go down those places and get themselves treated. And that same thing happened basically during this COVID-19, because some of our healthcare centers, some of our community health centers are not well equipped. When you go there, there are practically no paracetamol. Maybe max you see this paracetamol. Whatever diagnosis you're given, you may need to still buy the drug. So sometimes they will insist that you go through tests, the malaria test, typhoid test, sometimes it's blood tests. Then they'll still also collect drugs. Okay, you also pay for the drugs you're going to take. So why go through those stress of paying for drugs and all the likes? Why you can easily walk to a chemist or a pharmacist? If it was even a true pharmacist shop, that would have been nice. Sometimes this chemist shop, you go there, they'll just say, oh, but I'm not feeling fine. You get to they do me for head and all that. They'll just say, okay, organa malaria. They mix this one, mix it. Sometimes they won't combine it. They say, take this one 4 times for 4 days. You don't go, everything don't clear. And so we have gotten used to it basically. So you do not expect that what you're seeing now is, the real actual figure of COVID-19. A lot of them may have, gotten COVID-19, but until it is probably out of proportion, that's when you see them going to report themselves that, okay, this may not be the regular typhoid or malaria, which means while they are passive carriers, they have infested and, compromised their family members in the process. In a moment, we're going to show you an audio. You listen to an audio by a certified NCDC consultant. I think one of those who work with NCDC. They have been she was giving a field report, and the place she mentioned in Lagos that has been fully compromised is alarming, is amazing, is shocking. She went further to explain that, look, already Lagos is fully compromised, and some of these places and not even coming out. They had to go down there, so okay, let them just do 1 or 2 tests. And what amazed them was the fact that about Amu-Odofin, for example, she mentioned Amu-Odofin. She said the entire Festac area is fully compromised. What that means, just watch the video, watch the audio, then we'll come back and look at what we're looking at is a dangerous situation in our hands, which means all those living in Festac area, Amu-Odofin area, those who go to Baju markets in that area also, don't play down on your face masks. Don't look at it as, okay, it's my neighbor now. After all, I've not recorded any cases in these places. She's saying that out of every 40, about 10 to 15, that's about 30% every day of anyone you test in Festac area already are COVID-19 positive. And this has not found its way into the records of NCDC just yet. Now, that means already as we speak, Festac town is a town sitting on keg of time bomb. Just a matter of days, if nothing is done in that Festac area, Amu-Odofin area, which means we may be hearing scores and scores of deaths emanating from there. Let's listen to her audio, then we'll come back again and analyze the repercussion and the consequences of this whole action.
I was posted to Amu-Odofin local government as the NCDC supervisor there. I've been supervising the active case search, okay, which is the reason for the increased number of cases which you are now seeing. NCDC, in collaboration with the Lagos State government and through the local government structure, decided to do house-to-house and hospital-to-hospital search of coronavirus cases, and the numbers have been alarming, and it's reflecting in the reports you are now seeing, so that's how come about that increase in numbers now. So I'm supervising Amu-Odofin local government. It was a 10-day project. We're tasked to search for cases from door to door, and then from private hospital to private hospital, and then government hospitals as well. And it's been quite interesting. So Amu-Odofin is a hot mess as we speak. The amount of community transmission going on there is crazy. So Papa Odoye, this is for you. Avoid, that is, don't approach Aboju market without a face mask on. Where you must use an ATM, still have your face mask on, have your hand sanitizer ready to sanitize those buttons. Amu-Odofin, the entire Festac area is messed up. I mean, if we take samples of, for example, 40 samples per day, we are seeing up to 10 to 15 positive cases out of 40. So that is alarming. Okay? So apply extra care. Everyone who is living in the Festac axis, just apply extra care because...
All right, welcome back. You have heard what she said. She said the community transmission alone is amazing. He said sometimes, because the truth of the matter is, as humans, we need to communicate. There's some basic things we need to do. Even though the banking services are skeletal, what it means is that there's no full banking services here, but we can actually use the e-banking, channels like the ATM, okay, to withdraw monies. Now imagine someone who's already COVID-19 positive using that ATM. She's not saying, look, we're not saying you shouldn't withdraw, but the truth is you have to be extra safety conscious. What that means is that make sure you're always on your face masks. You don't joke with it. Also make sure that you're with your hand sanitizer. Before you use the ATM, you use your hand sanitizer to clean up the buttons. Then after you use ATM, use your hand sanitizer immediately. I was actually witnessed one that was really amazing. The young man didn't even bother. He was wearing gloves, so he still used stick. He used his car keys, punched whatever he wanted to punch. And when he was done, he used the hand sanitizer with his gloves still, and cleaned off his car keys, and then he drove off. What am I trying to say? There are other means apart from, if you don't have hand sanitizer, you can go with gloves and all that. But she's saying, look, you may be looking at your neighbor as that your neighbor could be actually COVID-19 positive. While we are looking at Kano, we are looking at the Lagos have testing areas and all that. A lot of persons have come over and said, look, even this issue of testing is actually a conspiracy theory. I don't know how true it is. You know, a lot of Nigerians in diaspora have given out voice notes to their siblings, their relatives, saying, please do not use the testing kit that is being compromised, that is carrying the real deal, it's carrying the COVID-19 proper. But the truth is, how would you then know those who are COVID-19 positive if they do not, go for testing? But he now said, look, you give yourself 4-5 days, you show the symptoms, and he even went further to show some certain, herbs that can be used, to clean it up. Like a typical example is of Makinde, or your state governor, what he used to clean off the virus from his system. But that I'm not selling that anyway. What I'm saying in effect is that right now, as we speak, Lagos, Amu-Odofin area, Festac town is already sitting on a time bomb, and these guys are not coming out for they've not gone out for testing. They still look healthy. They just feel stressed. Okay, this is stress here and there, maybe because of the COVID-19, the lockdown. They've not been eating well and all that, so they are not seeing it that they're actually COVID-19 positive. And now she's screaming that, look, even the market area is already compromised. She even went further to say that about 40 out of 40 persons they test in a day, 10 to 15 of them are COVID-19 positive. Could this conspiracy be true? Could it be that those testing kits could actually have the COVID-19 virus itself? I don't get it. How did it enter? But then it's not for me to question. The truth now is everyone must be on guard. While we shout Kano, Kano, Lagos maybe also be compromised. Amu-Odofin may be the next hit. Festac town may be the next place we're going to be hearing scores and scores of that. And she has already done a voice note telling everyone, please, if you're living in that axis, Festac town, or if you have any relative, any loved one, any friends living around Festac town area, living around Amu-Odofin, should please be on red alert that quite a number of them are COVID-19 positive, and it is basically transmitted. It's quickly transmitted because of the community transmission. It's making it faster because of the way the community is built. So she's now admonishing everyone to be safety conscious. But that's how much we will take. It's more like a wake-up call. It's also a warning for those living in that area to please be on guard. But I know also that some persons may want to migrate out of Festac town to other places. If they're already compromised, then they compromise the new city or the new community they're going into. So you see that this whole thing, I don't know what Nigeria president will do now, whether lockdown is what we should be asking for, total lockdown, or whether we should be talking of partial lockdown. If it is lockdown then that means these guys will keep transmitting this every hour. I hope that what Melinda Gates predicted about Nigeria won't eventually come to pass if we are not careful. But that's how much we can take on this. What do you think about this latest development coming from Amu-Odofin and the entire Festac area that's already been compromised with COVID-19? Let's meet in our comment section. Don't also forget to share and like our video. Let's interact. Stay tuned for more updates. Have a nice